Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hip. It is the Stinchfield test, or the hip flexion resistance test. This test was developed by Dr. Frank Stinchfield, and it is looking for any kind of intra-articular issue going on with the hip. So something like arthritis, a synovitis, they said like, or loosening of a prosthetic in the hip. And I will say, he didn't write about this test, so there's no like original paper where he talks about it. There is a paper where someone talks about Dr. Stinchfield's life and his profession, and say like he did publish a whole lot, he did a whole lot of stuff with the hip, and this was just a test that he utilized very frequently, so it was just kind of just spoken about. So to perform this test, it's actually pretty simple. In that paper that talked about how Dr. Stinchfield did this, he would have the patient lying supine, they would flex their hip with the knee extended, and then he would apply a downward pressure. And a positive was a reproduction of their pain symptoms. And they said very often it would be a groin pain, thigh pain, buttocks pain, sometimes a knee pain, sometimes a weakness. Now some other people have given some more specific data on it, on like how to do it. They said you raise it up anywhere from 20 to 45 degrees. One article talking about here later had everyone raise it up to 30 degrees. Likewise, the placement of the hand, it wasn't really spoke about, but what I have found is typically it's like right above the knee, right there. And when just applying just a gentle force, it's not like a really hard force. And again, it kind of, I will say with the production of pain, some of the stuff was kind of all over the place. But that's how you do it. Laying down, flex the hip up, hold that, keep the knee straight, press down. Oh, does that produce your pain? Positive, boom, it's a positive test. So when it comes to the research for this test, there's not a whole lot out there. One article did look at, they took a group of individuals that had hip pain. They did several tests on them, but provocation tests. So they did Scour, Faber, Stinchfield, and internal rotation with overpressure. And they just marked that they were positive. Then they did a intra-articular injection in it. They had a 80% or more relief of symptoms. They said, okay, then they did have an intra-articular issue. And the Stinchfield had the most specific, it was the most specific test at like 32%, so it wasn't really super great. And then the sensitivity in there was like 59%, so not maybe super great on there. Another one, they were trying to use it for the diagnosis of hip labral tears, and they found like out of like 18 people, like nobody, like one person had a positive on it. So is there. So like I said, it's not really like a normal test that's really spoken about a lot. However, Dr. Stinchfield has quite a bit of stuff that for the hip research that has come out about him. So interesting thing from there. So that is the Stinchfield test. Have you ever heard of it? Do you do it? Do you think maybe we need to do a little bit more research on that? So let us know down in the comments below. And of course, like always, take care of yourself, take care of your patients. We'll see you next time.